Hi, everybody. This is Aaron Hautala, and welcome to Moses Lake Community Initiative Updates. A little backstory on myself. I help Moses Lake lead with both the community input sessions that we hosted in the community and the public survey, and I will be your host today. As a time reference, prior to the pandemic, Moses Lake Lead identified 11 topics that were consistently mentioned as opportunities our community was passionate about. And our original plan back then was to hold a community summit in person to discuss these opportunities. However, as we all know, and especially our guests on the call today, the pandemic had other ideas. And every time we wanted to get together, there was no opportunity to actually host a large group together to talk about the amazing information the Moses Lake community brought to the table. So with that said, let's get into it. And today we're excited about our three guests as it's healthcare in the Moses Lake region. And we have with us Greg Fletcher of Confluence Health. Greg, say hi to everybody real quick. And
hi, everybody.
Hi, Greg. And Sheila Burschauer of Moses Lake Community Health. Hi, Sheila.
Hi.
And last but not least, Teresa Sullivan of Samaritan Healthcare.
Hello.
Hey. So thank you guys for being with us today, and just for the time and keeping these short so people on Facebook or on the website can watch a lot and get a lot quick. I want to get right into the first question, if you will, and what we learned in our community input sessions and the survey that we did in the community. We had 700 responses at least on the survey from the community. The community was asking for this of the Moses Lake community healthcare partners. They were looking for improved access to specialty and primary care providers, and ideally without having to wait months for an appointment. And that's a fairly straightforward question, and I'm just going to get right into it. So with Greg, kind of the question to you, and then we'll follow with you, Sheila and Teresa, is could you just tell us, in addition to COVID and everything that's happened in the past 2 years, what has been updated on the Confluence front from a specialty care or a primary care that we, the community, we need to know
about? Thanks, Aaron. Thanks for the opportunity for being here today. Confluence Health has worked to improve specialty access in Grant County since it started its first clinic here in 1979. The Moses Lake Clinic originally opened with a couple of family docs and a general surgeon. For the past 42 years, we have grown our on-site specialty access in not only general surgery, but other specialties like orthopedics, gastroenterology, ENT, radiology, and others. In addition to the permanent on-site specialties that we offer, Confluence has grown its ability to provide outreach services from Wenatchee. Some of the outreach services include rheumatology, oncology, cardiology, allergy, and others, all of which are seeing patients right here on our Moses Lake campus. Confluence has also launched into the use of virtual and phone visits, largely due to the COVID pandemic. And these visits can be for either specialty or primary care when appropriate. Confluence feels that access to specialty services and primary care services in Grant County are right in step with our mission, vision, and values. And the advantage of our multi-specialty system are that we do have on-site specialists, a wide variety of outreach specialists, virtual access, and our primary care physicians have direct consultation ability with the specialists, which are all tangible benefits for patient access, and in the end, keeps most of our care local.
You've been busy. Confluence has been busy. Sheila, we're taking the microphone and handing it to you wherever you are on this Zoom Brady Bunch photo we have going on here, but same question. Specialty care, primary care, tell us more.
Well, it's probably the little known fact that Confluence Health and Moses Lake Community Health Center actually got started in the Moses Lake area at the very same time back in 1978. We started as a dental clinic and then expanded into primary care in 1980 with the first medical providers that came on. So I had forgotten that fact until Greg brought it up that we have the same birthday here at Moses Lake. So our clinic is focused primarily on primary care, obstetrics, internal medicine, and pediatrics. you know, very much like the other clinics in town, we've had a focus on recruiting and growing as the community has grown. Yet we have just finished a substantial construction project here at Community Health. So last year, we did expand our medical clinic by 30%, our dental clinics by 30% to meet the demand that is going on in the community, and then obviously the surrounding community as well. In Moses Lake right now, we've got 16 family clinicians dedicated to those 4 specialties that I mentioned, and we hope to be able to grow by the 30%. The piece that we do with specialty, since we don't have the in-house specialists like Confluence and Samaritan, is that they are our primary referral sources and have been for years. And for the most part, all of our referral needs are met by Samaritan and Confluence. But we do something very similar to what Greg mentioned, is that it's that direct consultative care. And we've actually contracted with a nonprofit just this last year to be able to provide additional consultative services to the primary care physicians. So many times for the patients in this area, if the family practice doc is able to talk to that dermatologist or gastroenterologist and coordinate on that care plan, it can save for that specialty visits, could save for the travel and such. So those are the ways that we've grown in primary care and some of the advances we've made to try to increase that specialty component.
Wonderful, Sheila. You as well have been busy in your organization.
Yes.
That's incredible. And Teresa, same
Yeah.
question.
Awesome,
Specialty
thank you.
care, primary care, what's up? What's happening?
Well, a lot of things happening here too. So I would say, first off, as a public hospital district in the community, obviously we work very closely with both Confluence Health and Community Health. Samaritan was formed by the community back in the late 40s and early 50s, and really didn't get into, I would say, clinic-based care. I think it was more like into the 90s. So I would say since 2017, we've really seen a lot of growth. And I would say that growth is in addition to the family medicine, pediatrics, OB, those kinds of services that we had at that time. But we've added over 30 new physicians and providers since 2017. This increase has also meant an increase in our specialty care services. So we've added 10 new specialties to our clinics, and those would, I'm just going to run through them because there's a lot of new services in additions to the ones I mentioned. So internal medicine, a really big growth area has been behavioral health. We've added a child psychiatrist and an adult psychiatrist. We've added a cardiologist in partnership with Providence Health. We added gastroenterology, occupational medicine, pain management, urology, pediatric endocrinology. In addition to the general surgery that was already in the community, we added general surgery. We've got orthopedics and podiatry, and some focus on sports medicine. The other thing that we did is we recruited our own hospitalist and emergency medicine physicians. So part of what we've been really focused on is having providers that live and work in our community. And I would say that in addition to the growth of those specialties that I mentioned, we've also expanded our family medicine base that we had, as well as our pediatrics. The other thing we did was we added a couple of other telemedicine programs. Greg mentioned telehealth. We've been doing some of that, but we added telestroke. We also added maternal fetal medicine, which is a big deal so that we can have more high-risk pregnancy care in our community. So in addition to that, we added access in the community by our clinic on Patton, which was a big deal in that underserved area. And I would say all of this has also really meant a growth in other services within our hospital. And we've grown from 500 employees at that time to over 700 employees. So we've seen a lot of growth in the last few years.
It's amazing the amount of growth on all three stories here.
Yes.
This is a community that is growing. This is a community that is and you're delivering a lot. I mean, that each of you, Greg, Sheila, Teresa, thank you for that information. For myself, and I hope many others, that paints a pretty nice overall picture of the resources available right here in Central Washington. And if you haven't heard it today, thank you for all the work you're doing for the healthcare needs here, you know, with primary and specialty, and also the work you've done through COVID. It's a lot. You have taken on a lot, and we appreciate you. Now I have to go to the next question. You ready? Are we all ready?
We're ready.
Greg looks ready. Okay, Greg, you're not first this time though. Teresa, you get to go first this time. The pop quiz question is kind of fun. I like these ones because you get to dream a little and you get to look into the future. And let's just go into our visioning and look maybe 3 to 5. You don't have to pick one, but sometimes how it works. 3 to 5 years in the future. And yes, I know there's a pandemic and we're not out of it quite yet. But what do you see for each of your organizations and being able to continue this growth you've already talked about in the delivery that, you know, what healthcare could look like for each of your organizations 3 to 5 years from today? Teresa, you're up.
Yeah. So I would say I see continued growth. Our community is continuing to grow, and the need for services in our area is really continuing to grow. I would say I think we would see growth in expanding the depth of our specialty services. So for example, we already have another general surgeon that will be joining us in February of next year. We have an anesthesiologist who will be joining us in February of next year. That will be our perioperative medical director. So I see growth in depth of service as well as expanding the specialties that we add. So I think that those would be the things that I see from a provider perspective. But I would say the really other big thing is our build community, right? Our hospital has reached its capacity. We need more space. And so we're excited that we got our USDA approval to build our replacement hospital on that 55 acres out behind Lowe's. And we're hoping that we can be able to break ground in late spring or early summer of 2022. And one thing I would point out about that project, Aaron, is that what we heard from the Grant County EDC is that this is the biggest economic development project in over 40 years. I should say public economic development project in over 40 years in Grant County that has not been supported by like a tax bond or levy. So we're excited about that and looking forward to being able to move that forward.
It's amazing. Moses Lake is the place to be, right? It's
Yes.
like, if it's not happening, it's not. I mean, it's happening here. I don't think it's like I don't know any other community that has the stories you're telling. This is crazy. Sheila, you're up. Looking out 3 to 5 years. What do you see? What do you see?
Well, just wanting to continue to grow as our community grows. So we currently have medical clinics here in Moses Lake and in Quincy. We've got dental clinics in those two communities as well as Ephrata. So continuing to want to adapt and change to the needs of the community. As Teresa and Greg mentioned earlier, having integrated behavioral health is a key component of our primary care practice. It's something we've been doing for about 15 years. So as we continue to build out in our medical primary care specialties, wanting the integrated behavioral health to grow at the same pace. So we've been doing a lot of recruiting in that area lately and will continue. But I think the other piece that goes hand in hand with medicine is the need for pharmaceuticals, pharmacy services. So within our clinics in Moses Lake and Quincy, we have built out our pharmacies, but that's a program or line of business that we want to continue to grow and move into other areas of the Columbia Basin. So just continuing to maximize what we have built here, just finished last year in Moses Lake, look again at Quincy, and then probably expand into another community here in the Columbia Basin over the next 5 years. So it's all pretty exciting.
Thanks. Good things are in store.
Good things.
Good job. Greg, you're up. You get the final batting order here on this question. 3 to 5 years out. What do you?
Like Teresa and Sheila said, I think that the future will bring continued growth, recruitment, and retention of providers in the Columbia Basin. It has been for a long time and will continue to be a primary focus for all of us, I believe. I think the most exciting service we'll be bringing to the Moses Lake community is our radiation oncology center that we plan to break ground on early 2022. Confluence Health partnered with the Columbia Basin Cancer Foundation and together with the help of the community, raised the funds necessary to bring that service into our community. It'll be a big addition to the region and a giant step at keeping our cancer care local. And in addition to the Radiation Oncology Center, up kitty corner from where Teresa's building our new hospital, we have a piece of ground where we recently built a small specialty care clinic there. We're going to continue to develop office space on that location, and it will allow us to continue specialty service recruitment and primary care recruitment. So that's kind of what we have going for the next 3 to 5 years.
Wonderful update. It's fun to get all the updates at once. I mean, I think anyone who's listening at this point can go, well, that's good to know. I mean, this is really good to know. So thank you each for taking the time out of your day to help the whole community understand the good and hard work you're all after. So I have
Aaron,
one.
could I add one quick thing? Because I think one thing I heard from all of us say
Yeah.
is that we are all really working regionally. And one thing I didn't mention is the Grand Columbia Health Alliance and the work with like Quincy, just like Glenda mentioned, Cooley, Ephrata, Othello, Ritzville, and Odessa. And I think really having that regional care that I think Moses Lake and all of us provide to that region. So the Grand Columbia Health Alliance, I think, is a key part of what Samaritan is working on for the future. Yeah.
Collaboration in this area is amazing. Really, it's
That
really cool.
collaboration piece made me think of an important piece. So I'm glad Teresa remembered that. We've just recently collaborated with Quincy School District and opened the first school-based health center in Grant County. And so that's another huge piece as far as opening access to communities that struggle. So that's another piece that we're just keeping our eye on, is how monitoring the success of that program and seeing if there's any expansion possibilities into other areas. So that's been really exciting.
Yeah, it is exciting. Good job. I have one final question. And this is a kind of a Moses Lake lead intention or goal, is bringing the community together. You know, I mean, a lot of this information is sometimes hard to get, but when we can share information together as a community, maybe there's people out there that want to help or have questions or ideas. So in closing, Sheila, you're first up the bat for this one. Is if a community member has additional ideas or questions or desire to volunteer, donate, or help with anything, what's the best way for them to reach out to our organization?
509-766-2361. That's my cell phone. You can call me.
Wonderful.
So if anyone's interested, but I think just, for all of us looking at our websites, there's great information on the 3 websites and the contact information. I have a direct link when people send an email through the website. I get to see it. So that's another way in which to communicate with our organization.
Thank you for that. Greg, you're up. Same question. How can someone reach
Much
out?
like Sheila, we have a very information heavy website as well. It's an easy way to gain access, but really at the end of the day, a direct call to myself or a direct email to myself will gain you the most direct access.
Wonderful. And Teresa?
Yeah, I think kind of the same answer that you've heard. I would say our website has a lot of information. Contacting me directly, either email or phone. And I would say another great person is Gretchen Youngren from our Development and Communications Department to contact her as well. So either one of us.
Well, wonderful. I think just the ability for people to know that you guys have an open door, and that, hey, we want to do this together, hand in hand, we're a part of this together. So in closing, I want to thank you again, Greg and Sheila and Teresa, for joining us on this Moses Lake Lead video. I think we can all agree healthcare is essential for the quality of life of Moses Lake and Grant County. And for me personally, and I hope a lot of people watching, it was wonderful to understand the good work being done in collaboration to best serve the residents, the seasonal residents, and visitors that come to this area. And then for folks still watching at home, if you want to stay tuned, there's going to be more videos like this on the other priorities that were learned in the input sessions and the community survey. And if you at home want to get involved with LEAD, we will provide our information because we're in the same boat. And the best way to reach out to LEAD is on the Facebook page, which is facebook.com/ that's a slash like that, Moses Lake Lead, or the email address for LEAD is moseslakelead@gmail.com. I'll say that again, pretending I'm on a radio ad. That's moseslakelead@gmail.com. Thank you, everybody, for being on this call today, and a virtual high five to each of you.
Thank you, Aaron.
You're welcome.